Eating disorders. Eating disorders are a range of psychological conditions that cause unhealthy eating habits to develop. They might start with an obsession with food, body weight, or body shape. In severe cases, eating disorders can cause serious health consequences and may even result in death if left untreated. In fact, eating disorders are among the deadliest mental illnesses, second to opioid overdose. People with eating disorders can have a variety of symptoms. Common symptoms include severe restriction of food, food binges, and purging behaviors like vomiting or overexercising. Although eating disorders can affect people of any gender at any life stage, they're increasingly common in men and gender non-conforming people. These populations often seek treatment at lower rates or may not report their eating disorder symptoms at all. What are the signs of an eating disorder? Different types of eating disorders have different symptoms, but each condition involves an extreme focus on issues related to food and eating, and some involve an extreme focus on weight. This preoccupation with food and weight may make it hard to focus on other aspects of life. Mental and behavioral signs may include dramatic weight loss, concern about eating in public, preoccupation with weight, food, calories, fat grams, or dieting, complaints of constipation, cold intolerance, abdominal pain, lethargy, or excess energy, excuses to avoid mealtime, intense fear of weight gain or being fat, dressing in layers to hide weight loss or stay warm, severely limiting and restricting the amount and types of food consumed, refusing to eat certain foods, denying feeling hungry. Physical signs may include feeling cold all the time, sleep irregularities, menstrual irregularities, dry skin, dry, thin nails, thinning hair, muscle weakness. What causes eating disorders? Experts believe that a variety of factors may contribute to eating disorders. One of these is genetics. People who have a sibling or parent with an eating disorder seem to be at an increased risk of developing one. Personality traits are another factor. In particular, neuroticism, perfectionism, and impulsivity are three personality traits often linked to a higher risk of developing an eating disorder, according to a 2015 research review. Other potential causes include perceived pressures to be thin, cultural preferences for thinness, and exposure to media promoting these ideals. More recently, experts have proposed that differences in brain structure and biology may also play a role in the development of eating disorders. In particular, levels of the brain messaging chemicals serotonin and dopamine may be factors. Types of eating disorders. Eating disorders are a group of related conditions involving extreme food and weight issues, but each disorder has unique symptoms and diagnosis criteria. Here are 6 of the most common eating disorders and their symptoms. Anorexia nervosa. Anorexia nervosa is likely the most well-known eating disorder. It generally develops during adolescence or young adulthood and tends to affect more women than men. People with anorexia generally view themselves as overweight, even if they're dangerously underweight. They tend to constantly monitor their weight, avoid eating certain types of foods, and severely restrict their calorie intake. Common symptoms of anorexia nervosa include very restricted eating patterns, intense fear of gaining weight, or persistent behaviors to avoid gaining weight, despite being underweight, a relentless pursuit of thinness and unwillingness to maintain a healthy weight, a heavy influence of body weight or perceived body shape on self-esteem, a distorted body image, including denial of being seriously underweight. Anorexia can be very damaging to the body. Over time, individuals living with it may experience thinning of their bones, infertility, and brittle hair and nails. In severe cases, anorexia can result in heart, brain, or multi-organ failure and death.